All right, back to the breaking news we told you about at the top of the hour. The federal government says it will partially fund the National Food Assistance Program known as SNAP.
The announcement comes just days after two federal judges ruled the administration must keep the program running and provide benefits to low-income families. The 1 million people who rely on the assistance, instead they are flocking to food pantries, food drives like this one at the Norwood Police Department. Joining us now, Dr. Ali Raja, Vice Chair of Emergency Medicine at Mass General Brigham. Dr. Raja, thanks for joining us.
All right, Dr. Raja, how would you describe this situation right now? Is it an emergency?
I would say that it is, Ben. You know, food is as fundamental as oxygen or shelter. When people don't know where their next meal is coming from, everything else really takes a back seat, and medications and doctor visits, even paying rent. So we see this in the emergency department all the time, and there is research that shows that food insecurity is directly linked to worsening chronic conditions like diabetes and heart disease, and it often pushes people to delay care until things become true emergencies.
So if the situation continues, how soon could, kind of those complications of this affect ERs like yours?
Soon, Erica. You know, when food benefits are disrupted, we see more patients just in crisis, not just from hunger itself, but from the ripple effects downstream. Fainting, malnutrition, medication errors, even infections that worsen because people can't take food with their antibiotic prescriptions. It's a predictable surge in emergency visits that strains hospitals, especially safety net facilities, and I'm worried about it for the entire country.
So do you and your colleagues, Dr. Raja, typically ask patients whether or not they have regular access to food, or does it depend on, whatever symptoms somebody comes in with?
It's a good question, Ben. We've started to, at least here at MGB, but it's not common practice nationally. There was actually a recent study just a few months ago that found that fewer than half of emergency departments in the U.S. routinely screen for food insecurity. Now, that's changing as more and more of us recognize that hunger is a medical issue, not just a social one. And I think that given what's happening now, it's probable that every hospital in the country is going to have to start asking that question.
Okay, Dr. Raja, as always, thanks for joining us.
Thank you.
Thanks, Erica. Thanks, Ben.